And some new warnings about the part of the president's health care law that some say could see your deductible moving higher. And it could have you waiting in line for a checkup at your doctor's office. Really? We'll see what that's about. We'll be right back.
If you get your insurance through your employer, your insurance could be changing very soon, and the price tag of that insurance in many cases is going higher. John Fund, national affairs columnist for the National Review, with us now. And nice to see you, John.
Thanks.
Good morning. We're talking about Cadillac plans. What's a Cadillac plan?
It's loaded with all the extras. You have very low deductibles. Let's say you only pay $2, $5, $10, $15 for a doctor's visit. You get all the trimmings.
Okay, now who gets this? I mean, because usually what, you find this with big companies using a Cadillac plan?
Well, you'll find it with some state and local governments, certainly. You find it with big companies that have old union contracts that stipulate this, and also some legacy companies that just have always had a very paternalistic attitude towards their employees.
So this is like your $500 deductible.
Right.
Your $20 copay.
Right.
That companies pay $12,000 to $16,000 a year to cover you as an employer.
Maybe over $20,000
and we never
family.
see it, right?
Well, a lot more people would have higher pay if people shopped around for health care. And because your employer does the only shopping for health care, you never see that money because they can deduct it from their expenses, and that means the cost to them is much less than the sticker cost.
Okay, now the point in all this story is that this is going away, at least for some.
There's a Cadillac tax. Starting in 2018, but ramping up, it's going to be a lot of preparation for it. Starting in 2018, any employer that offers a Cadillac plan above a certain number is going to tax 40% on the value of that plan over the specified number.
40%?
Yeah, it's a real hit.
Who thought that was a good idea?
Well, they have half a good idea, which is health care costs too much, and we encourage overconsumption of it because 90% of health care is paid by the people who don't get the service. It's paid by insurance companies, by governments, by employers. So that's a problem. I don't think taxing it is the right solution. John McCain in the 2008 campaign had a better idea. He said, let's have a cap of what the deductibility for health insurance will be, the tax deductibility. Let's have it, let's say, $15,000, $18,000, and let's give that as a voucher to the employer, to the employee. So the employee shops around for the health care plan that fits them best. You know, maybe they want gym memberships. Maybe they want more preventive care. Maybe they want kids to have better pediatric services. And you know what? They would save money, and they probably would get to keep the difference because then they could put it into a medical savings account for extraordinary expenses.
So the idea is take your voucher, up to $15,000, and you go shop around.
Right.
And you know the bills.
And you know the bills, which means...
So you know the price.
You know, most health care is not emergency health care. Most health care isn't an appendicitis that bursts and you have to go to the hospital right away. Most health care involves things that you can plan for or that you can be encouraged to be healthier of through preventive care. Having people shop around would mean more of those plans.
But that's not one of the options here. So one of the options
one
that
size fits all is what's
right,
what
is
we're
that
get.
If a company says, hey, I don't want to be taxed at 40% in this Cadillac tax, what do those employers then do?
They're going to slash the value of the health care that they give their employees, and in some cases they're going to drop coverage completely because, as we've learned, a lot of employers say, you know, I can pay the fine, I drop coverage, people can go into the exchange, they can shop around for what they want. What we're going to take away is we're going to take away the health care marketplace and give it a one-size-fits-all government marketplace, because I'll tell you right now, the one-size-fits-all government plans is going to have a lot of mandates built into it. You know, it's going to require them to cover hair transplants. It's going to require them to cover all kinds for medical conditions. It's going to recover a lot of things that people don't necessarily want. So you're going to replace the quasi-competitive system we have now, which is, I admit, in a mess, with a one-size-fits-all government competition, and I don't think people are going to like the results because one size fits all is not the American way.
We're going to bring you back too because there's a lot more to talk about this. So, you know, you talk about the polling numbers, about Obamacare, and whether or not people will like it or not. A clear majority still are not happy with it.
Obamacare is less popular now than it's ever been.
John Fund, thank you.
Thank you.
With us here in New York. Nice
Thanks.
to see you. All right.